We're going to go ahead and get started, everyone. So welcome, good evening. Thank you so very much for joining us. My name is Blair Budd. I'm the director of the One Health Academy. So thank you for joining us tonight. And I'm excited that we can be together virtually after our extended break, and hope everyone is staying healthy and safe. I've really appreciated the patience during these uncertain times, and we've really missed seeing you guys in person and are grateful you're still willing to join us virtually. So we will be resuming One Health Academy monthly speaker series starting this month online until it's safe to meet again in person. So just so you're aware, this will be our new platform as we move forward. And some housekeeping notes on tonight's webinar. We would just ask that everyone please mute your lines, and we have two capabilities for interaction in the GoToWebinar platform. One is chat and one is questions. So for the sake of this evening, we are going to use the chat function for interaction during the presentation, and then the questions function we'll use for any specific questions following the talk. So just keep that in mind as we move forward. So thanks for your support in that. And we have a really amazing speaker tonight, and I'm excited to get to introduce her to you. So without further ado, Jessica Petrillo is an expert on global health security policy, working with diverse domestic and international stakeholders and partners to devise and implement strategic and innovative approaches to enable immediate and lasting change globally. She serves as a senior advisor for antimicrobial resistance and GHSA as a sustainable technical and analytical resource fellow at USAID, with responsibility for strengthening the agency's technical capacity in and strategic approach to advance priority health security objectives. Previously, Jessica served as a senior advisor for health security at the U.S. Department of State. She served as a lead negotiating and implementing the MBS and GHSA, and led the department's foreign policy work on AMR. She received her PhD in virology at Harvard University and conducted her postdoctoral research at the Scripps Research Institute. Please join me in welcoming Dr. Jessica Petrillo. Thank you, Jessica.
Thank you, and good evening, everyone. Let's try and make this happen. All righty. Thank you, Blair and the One Health Academy, for the invitation to speak this evening. And my thanks to the One Health Commission for making this virtual gathering possible, and to all the participants for joining tonight's exploration of COVID-19 and One Health. So I will be your guide this evening, and I'll be doing this in my personal rather than my professional capacity, but I will say that it is definitely informed, my role will be informed by the experiences of the last 20 years in this sort of health security space. This will not be an exhaustive accounting. Rather, my intention is to explore what a One Health approach entails, its challenges, its opportunities, and its value, and maybe we'll discover some aspects with which you are not already familiar. To accomplish this, I do have a request. Please consider using the chat feature to weigh in on the topics raised. We have a wealth of curiosity and experience gathered here. Let's see if we can use this digital platform, to put One Health into action. And as I said, I am coming to this with specific experience in the realm of sort of health security, and so with that I bring a few biases, which I'll just lay out at the beginning. One is very much the aspect of taking this sort of impact of zoonotic disease on humans, though not exclusively so, and also a focus on international outbreak prevention and preparedness. I'll also just fess up that I am probably going to refer the entire time to COVID, but I wanted to make very clear that COVID-19 refers to the disease, and the virus has a distinct name. And even though I am a virologist by training, and so my former professors are probably cringing, I am just out of habit going to be saying probably COVID and COVID-19. So with that, let's begin. So there are a number of different sort of definitions of One Health that really focus a lot, in the similar space, but tease out different facets of the problem. And so I'm going to go ahead with this definition that's up on the screen right now. And I really want to highlight this aspect of the multi-sectoral and the and the transdisciplinary, sorry. And this is really recognizing this aspect of differences potentially between sectors and disciplines, and the critical role of weaving these all together to be able to really have this integrated health outcomes. And while I said that the discussion this evening is not really going to be exhaustive, it's actually really going to be pretty focused on looking at how do we understand transmission, and really, as I said, exploring what does it take to have a One Health approach to answering these questions, and why would we need a One Health approach to do so. And so what we're really looking at is sort of this issue of, we have the first group of humans infected, and the sense that it is, or awareness that it is a result of a zoonotic disease. What do we do next? And so that's what we're really going to talk about. I'm going to cover this evening. Excuse me. So as the first step, we have this question of, what is the source of spillover? Again, humans are starting to get sick in a large enough number that it's been recognized as an issue. And the causative agent is this zoonotic virus. One of the first questions is, what is the source? Why do we need to answer that question? Well, first step is really just trying to reduce the incidence of infection. We want to reduce the likelihood of humans getting infected. Figure out where the animal is, what the animal is, where the exposure is happening, and you can reduce the incidence of having humans put in under the conditions that put them at risk for getting infected. Also, sort of for the next outbreak, it's incredibly helpful to be able to know, sort of what are the types of animals, what are the types of conditions that these sorts of zoonotic spillover and then exposure can happen, to better prepare us, as I said, for the next outbreak. So how do we find out? So I've kind of bucketed it into these 3 topics: testing, kind of what animal, where. I'm going to tackle them one at a time. There's really no way to like if you're actually trying to do that, they're all integrated. But for the purposes of this sort of discussion, I'm taking them one at a time. Testing. So, I think, pretty much when you start off, you're like, okay, no problem, right? I'm going to go do the testing. We're going to figure this out. But I want to just walk through. There are a lot of facets when we start getting into the issue of testing. And just so you're not, worried, this is the only slide that looks like this with a ton of questions. But I wanted to start off really getting at this sense of, there are a lot of questions that need to get answered. And the responsibility falls under a lot of different sectors, a lot of different capacities. So just sort of running through some of what we're talking about when we're getting into these, questions surrounding testing. Just the basic one: is there a test? How available is it? Think about, who does it take to find out, to make the test? How reliable is it? How reliable does it need to be? Who are the folks that need to assess the reliability? Who are the folks that need to say, how reliable is it? Is it reliable enough for the questions that we're trying to answer? Who has the authority? Who has the capacity? Then, once we're at the situation of a test, who has the capacity to run it? That includes having the availability of tests, but it's also the reagents. And then you get into, are the reagents available? Are they of a quality that, meets a standard that you need in order to run the test? Is the infrastructure available? Is there running water? Is there the electricity? We also get into, how reliable is the equipment that's running the tests? Are there people that can calibrate them? Have they been, is there some certification to make sure that the people that are doing the, are doing the quality assessments of the machinery qualified? Who has the authority to run the tests? So when we're talking about situations, again, like when we're looking at the animal sector, we can have wildlife, we can have, food sector, we can have pets. Those are different sectors of folks who may be interacting with the animal species to be able to do the testing. So who has the authority? And then, again, do they have the capacity? So do the people that have the authority have the capacity? And then we're taking a step back and saying, well, what about collecting the samples? Who has the capacity to collect the samples? Can they collect them safely? These may be samples that are infectious. Do they have the ability to do it safely? And who has the authority? Again, we may be working in different sectors, and folks may have the authority for the environment in which you're looking to sample, but may not have the capacity. Similarly, with the ability to transport, the responsibility to transport, and then you get in the question of the physical safety of being able to, transport the samples in a way that's safe, secure, that doesn't expose the folks that are transporting it. Same issue with storing, disposing. How long do you hold samples? And that's just sort of getting up to sort of the data collecting point. But then what about the data? How are the results communicated? What information is communicated? To whom? How? Do we have an understanding of, similar data, how you capture it, how you characterize it, so that samples being collected in one place and analyzed in one place, can be compared with those studies that are being done maybe on the other side of the world or in the facility down the street. Who has the answers to these questions, right? It may not be just one person, but how do you end up answering these questions, and who's responsible for the decisions? How are the decisions made, and how are they communicated? So I hope you can see that even once we start talking just about sort of the testing side, you have wildly different capacities, you have wildly different sectors, from policy to, technical, to IT, to, quality assurance and training. And, all of these sectors, all of these disciplines, all of these communities need to be able to come together to be able to tackle just this problem around the testing. So we're going to say, hey, we got the test. We got this. How do we know what animals, right? We know it's a zoonotic. We're going to say, you know, one of the main ways kind of we look is looking at the past. And one of the ways we can do this is, again, you know, it's like when the first, when the outbreak first happens, one of the first things that's done is then looking to sequence the virus. And from the sequence data, what we can get is, you know, what are the viruses most close to? And so one of that is looking at history. Okay, so in this case, figured out it was coronavirus. What are the other animals, you know, what are the other routes that coronaviruses have taken through animals to be able to get to humans? And so understanding that past is a critical component of being able to really kind of look at the now, at the emergency situation, to get a sense of what might we be working with. And so, as I said, there's the historical data to be able to also put into context the sequence data. And so when we talk about the sequence data, again, as I said, you know, we need the historical, you need the library, but you also need the ability to, you know, this data platform, the ability to do analysis of the data that you get with the past data there. And so again, we're talking about, you know, researchers throughout the world, you know, past history, understanding kind of all of the dynamics of past outbreaks that are related to the type of virus that is happening during the emergency. But then also these elements like the data platforms to really be able to share the information quickly, which then gets you into the whole, you know, IT experts and that whole realm. So one of the ways to figure out sort of what animals is, as I said, like looking to the past, looking at the sequence data. The other aspect is looking to the where. And so this, again, gets us at an aspect of the epidemiology situation where we're, you know, can we work back from the humans that were first infected to figure out where are the likely environments that the exposure happened. So this brings potentially a significant number of different areas of expertise and, as I said, sectors and disciplines together. Because as we're looking at zoonotic diseases, this is a ability to move from animals to humans. And we have the situation where, you know, as we've seen sort of, you know, there's the potential of kind of, and what we see oftentimes with coronaviruses is a reservoir animal being the bat. So the original sort of transfer over to what ends up being the intermediate animal. And it's through the intermediate animal that you then get the exposure to the humans. So we have wildlife, you know, and those entities that are responsible for understanding, you know, studying, you know, the exposure to, I mean, the animals in the wildlife setting. So for us, it may be like USGS, you know, understanding in those that are responsible for sort of the wildlife sectors. We've got the agriculture sectors or other areas where sort of the animal diseases can transfer over. And then this aspect of live markets, where you have the potential of having both exposure of sort of wild animals and the agriculture animals. and humans as a point at which, again, humans can be exposed, but also, the virus can be brought back into those sectors, whether that be, being brought back into wildlife or being brought back into agriculture setting because of these sort of interchange of having in close proximity, you have the wild animals, agriculture animals, and the humans that cross both of those settings. So that is some of sort of the kind of the complexity and the challenges and why you need, all these sort of different sectors working together when it comes to just looking at sort of that zoonotic side of the spillover from animal to human. And again, a lot of that is really steered at trying to, for a virus that is not able to be spread from human to human, to really stop the environments in which the infections begin. But once you start having, once we kind of figure out that there is human to human transmission, there's a whole nother suite of questions that need to get addressed, and all of which also have a significant amount of, as it said, multi-sectoral transdisciplinary work that are needed to address these questions. So what we're looking at here are some of the questions in terms of, can the virus be transmitted through contact and droplet? That's sort of one that I think people are a lot more sort of familiar with. It's sort of just the straight, contact to contact type situation. We also have the potential, because what we know about coronavirus is it is kind of this respiratory virus. There is an expectation that it can be transmitted through air. And so then you have to end up looking at this question of, well, what about airborne transmission? And I just highlighted a recent workshop that the National Academies had because I wanted to just flag this issue of the types of expertise they brought together to be able to answer this question: aerosol science, atmospheric chemistry, building engineering, epidemiology, environmental health, infectious disease, pulmonary medicine, public health, virology. These are the sectors that need to be brought into together to be able to tackle this question of airborne. Moving on to surfaces. Can the virus be transmitted from human to human via surfaces? Well, this gets into a whole suite of questions. Which surfaces? Where? And what are the highest priority? And what are we able to actually sort of follow up and test on? And I forgot to mention this on the testing, so I'm going to take a step back. But there's also the issue when we're talking about capacity. It's also important to realize that during an outbreak situation, there's also the same constraints on sort of the researchers as everybody else, which is, how close proximity, can you get? And it does have an impact, in terms of, how much research can they actually do and in what settings? And so this is another question that comes up also somewhat with the surfaces. We've got the issue of, are we talking in emergency rooms? Or, are we looking at our grocery bags? And what are researchers really, able to study initially? And a lot of that you end up getting in laboratory settings, and then having to do additional work later in terms of, well, what does that mean in terms of the actual real world settings? And so all of these factors have to be sort of taken into consideration as we're doing the surfaces and, studying, trying to figure out the question about transmission through surfaces. And then, communication between kind of all of those efforts has to be done quickly so that everybody can benefit from the knowledge base. that's being generated. Going on to environmental factors, these are things like, does air pollution impact transmission? One of the things that also I think is interesting in this space is, and as we're looking at this One Health lens, is this idea of, implications of the health of the environment on potentially the spread of the disease. So one of the things that I think many are familiar with are the California wildfires, and there's been attention to the impact of the wildfires on sort of the spread and severity of COVID. And so what we're looking at with this sort of situation is, one, displacement, having folks displaced because of the fire. So that can be, having to be housed in groups, in large groups of people, not being able to maintain distancing, water, sanitation, and hygiene, conditions, all of these aspects related to displacement. And also, I'm going to jump down to the stress component, that ends up adding the added stresses onto sort of your body and the implications that has for the types of immune responses you're able to generate. And then also the issue of the smoke and the potential this has for lung irritation, and what role that may end up having in susceptibility or severity of COVID. And so another route of transmission that needs to be looked at is urine and feces. And so they actually found an incidence with the SARS outbreak in 2003 of the spread of the virus through, it ended up being kind of, the toilet pipes in an apartment building. And, it was fairly unique circumstances, but again, it took, folks from medicine, mechanical, and civil engineering. It took this epidemiological analysis, computational fluid dynamics analysis, and multi-zone modeling to be able to really track this down and figure out this route of exposure that happened in this one apartment building. And so while we are talking about urine and feces, well, I'm going to take a detour on exciting things about poop. There's some exciting things about poop. So one of the things is really this issue of, it is a tool that is used for infectious disease surveillance in animals, and been able to use it actually for COVID, if I'm remembering this correctly, in bat guano. And so it gives an opportunity to be able to do sort of larger space surveillance in a way that eliminates some of the challenges of having to directly handle the animals, but when you start to really try to get just a, is it present or not? It's also sort of a fascinating example of this One Health approach when we start looking at sort of the bat guano space. So I started talking about the issue of, the opportunity for it in terms of disease surveillance. But what that also means is this issue of bat guano is a potential source of exposure for humans that are, again, like working with or that come into exposure with the bat guano. So kind of why would people be coming into exposure with bat guano if they aren't doing it for health surveillance? Well, bat guano is actually, there's a great economic value, and it is a economic resource. So you do have folks that sort of, so there's this economic component. There's, again, this health and safety component and the opportunity to inform future health efforts. And then there's also this conservation aspect related to bats. And part of that conservation is really also understanding their habitats. And that sort of understanding the habitat and the, and the behaviors and the interactions with humans can also be really incredible in terms of informing kind of the infectious disease analysis of where humans may be exposed to a virus, because it helps those people who are trying to find out the opportunity exposure to really understand, well, where do those positions of interface happen? And so while I talked about bat guano being one of the routes of exposure, it was also discovered that as a route of exposure was also palm sap. And so it ended up, it's one of these, it took kind of understanding the bat, how the bat interfaced with its environment to be able to identify the potential exposures of humans to diseases that were carried by bats. Other exciting thing about poop. This is one, actually, I'm very excited about this. The potential to use wastewater surveillance as a sentinel system for public health. It's not new, but this is a concept that I think is really starting to get some traction in COVID, and I think has some tremendous potential moving forward for health security. And so the idea is really working with sewage systems to be able to do surveillance, disease surveillance, infectious disease surveillance. Well, and what's the advantage of this? Well, you can start actually, again, doing this sort of sentinel system, like being able to get the early warning system. Is there virus detected in this population? And then you can do the follow-up in terms of the very specific testing, epidemiology, these sorts of things, but it's a trigger system. And so what you can do is something like, it could be related to a school. Are you able to detect it in the school population by assaying like the sewage versus having to test every kid every day, that comes in? Interesting thing about this is that this also entails totally different sectors, because then you start getting into the the actual like infrastructure for our sewage and water systems and the private sector in terms of this. And if you're talking about school districts, and trying to look at this sort of thing in schools, I mean, you end up getting a lot of different sectors again involved in trying to tackle this issue. But the potential of having this as I said, an early warning system, an ability to get, in a lot of ways, to have a lower infrastructure requirement to get some very basic health system outcomes. So this is, potentially the capacity needed to be able to at least have this sort of early warning sentinel surveillance system that underpins, and can help inform a potentially, smaller body of the actually highly trained kind of disease experts that are able to then do the follow-up once you've sort of identified, this is an area that the virus seems to be present. So next set of questions is, well, what about human to animal transmission? And is there the potential, again, this is a zoonotic. Is there the potential of the disease going from human to animal and then from the animal back to human. And a lot of this, what we've focused on, is around the companion animals. You know, what are the animals then that we have closest to us and that come into contact with more individuals? So this also gets into kind of interesting aspects when you start talking about companion animals. It kind of is a whole nother set of issues in terms of, you know, people have insurance. Some people have insurance, some people don't, for their dogs, their cats, you know, and so, you know, might the testing happen in vet systems? Like, and then are people gonna want to take their pets in for testing? And if you want to start doing the research of, can they expose humans back, like how do you do that, especially once you start getting into sort of this companion animal issue? So you know, but that's one of the areas that once you're dealing with the zoonotic needs to be checked as well. And what we're finding with COVID is an example of human to animal, where the animal does have that does have an impact on the animal. And this, what we've seen, are examples with mink farms, both in the United States and Europe. And so this becomes another sort of component where it's actually kind of potentially the human as the carrier to other animal species that have, you know, of the disease to other animal species. So that was a whole lot of, oh my goodness, there are so many questions. So I wanted to just sort of take a moment to say, you know, do not fret. That people have really been tackling this, you know, for decades. And there is dedication. So I just wanted to highlight, you know, some of there's, you know, some of this work that we see, sort of the tripartite, this FAO, OIE, World Health Organization. You know, this work to really strengthen global capacity to be prepared, you know, to prevent and be prepared for zoonotic disease outbreaks. There's work broader than zoonotic disease, but we're talking about zoonotic disease right now. You know, there's an effort to really systematically analyze capacity and set these sort of targets for how to increase and make sure that thresholds are being met in terms of this capacity. And there's groups, I've flagged sort of the Global Health Security Agenda and its associated entities, you know, private sector and next generation and NGO, you know, these entities that really are looking at, okay, so we've got these policy commitments, you know, this high level commitments, or as I have in the corner, this, what was just released, this African Union framework for One Health practices in national public health institutes. So this was just released in the last couple days, last week. Got these policy documents. There are also entities that really try to work towards converting those commitments, the policy issues, into tangible progress on the ground. And, you know, that's national entities, that's, again, nations, private sector, NGOs, academia, civil society, faith communities, professional societies, finance, individuals. You know, that there really is a lot of work that has gone in. And I think what we're seeing in this outbreak is also, you know, yes, the identification of some of known challenges, but also identification of some new challenges, or challenges that we weren't aware of before, but also the active involvement and innovative, you know, active involvement of a whole lot of sectors, you know, whether that be, you know, distilleries for making hand sanitizer, right? I mean, just, we've got all these different sectors and communities that are really identifying that and recognizing a role and a potential role moving forward in again, this sort of health security, this preparedness and response, you know, and for next. And also, I think we're identifying these sorts of tools, these like IT platforms, innovative approaches for dealing with some of the challenges that I think we can build on to really be able to make progress, to prepare for the next outbreak. And so getting close to wrapping up, and I wanted to say that just when we talk about One Health, when we're talking about outbreak prevention, preparedness, and response, I had this sort of fancy like multi-sectoral, it's really important to understand it's truly whole of society. And so I want to just talk about a couple things that I like about with the whole of society. And one is just putting up here 2 examples of sort of this community citizen participatory science, like however you want to term that. But this is really where, you and me, like where people get involved in just being part of sort of this science, this knowledge, this, informing the decision making. And one of these is the LEO network, the Local Environmental Observers Network, which was, which does just an incredible job of leveraging, the people that know the environment, that are out there every day, as part of the observers to identify, health impacts and what's going on in their environment around them. And one of the great things is it creates sort of a system to be able to have those that understand the changes that are happening, to be able to communicate and then help that inform sort of the science and the decision making, and have the science and the decision making also then come back, and it creates just really a strong community relationship in terms of sort of this environmental observer status. And then there's also the Globe Observer Mosquito Habitat Mapper, which is, again, it's a great way. It can get school kids involved, and it helps, again, kids kind of understand about sort of their environment, the potential role they have in, eliminating mosquito breeding sites to be able to help have an impact in terms of controlling kind of mosquito-borne diseases. And for scientists, it's an amazing, opportunity, because all of a sudden you have so many folks more, out there that are going and collecting data points. And so, it's really, again, one of these that fosters understanding and promotes participation. And so these are 2 kind of networks that I've come across that I think are kind of neat examples of, sort of true kind of participation, again, participatory science kind of efforts. And I'm going to end with just, man, use your sphere to influence the world. These are just a couple examples of folks saying, you know what, I can do something, and so when we're talking about students, here we go. And so I just, wanted to give a shout out to this, to say, we do all have sort of our spheres of influence. And when we're talking One Health, it really is the whole of society effort. And with that, I'd like to just say thank you and remind everybody that One Health Day is November 3rd, and a shout out to Antibiotic Awareness Week, which is later in November. And with that, thank you very much, and I'm happy to answer questions. Oh, and I'll hand over to Blair for how we want to handle the next steps.
Thank you, Jessica. I'm going to go ahead and read some of the questions that I have in the question box. So thanks for those that have been sharing. Does the issue of AMR fall in the definition of One Health?
Well, thank you. Yes. Oh, wait. Hey, Blair,
Yeah, go ahead.
should I shut this? Should I shut off do you want to take over the slides or?
Yeah, let me just give me one second.
Okay. So I'll go ahead and start answering that.
Yeah, go ahead and answer.
So AMR is absolutely a One Health issue, through and through. It's from, all the, whether it's all these different sectors that play a role both in the driving of the emergence and spread of AMR, but also in really reducing that emergence and spread. And so, I think AMR is definitely one of the, pretty much, AMR cannot be addressed without adopting a One Health approach.
All right. Sorry, I'm having troubles with the slides, so I'm going to leave it as is, Jessica, and
Right.
just do the next one.
Okay.
Okay. What about human activities that create risk of exposure to novel pathogens? The wild animals may be reservoirs of potential pathogens, but would not pose human health risk if those animals and their natural habitats were left undisturbed.
Well, I mean, I think that's, again, one of these things where when we talk about One Health, I mean, I think that question there just also indicated, a whole bunch more sort of sectors that need to get, that are part of the ecosystem that results in sort of the opportunity for humans to to end up coming into contact with wildlife that and having the potential exposure.
Okay.
So I wasn't sure if that was an answer to the question, because I wasn't sure if there was if the question or a statement.
Gotcha. It's okay. We can move on. Are you discussing testing for currently known zoonotic diseases? If so, how are the diseases prioritized by each country?
So there are, so as I kind of talked a little bit about, some of the work between, the tripartite and the sort of WHO, FAO, OIE. And there's a component related to, specifically, related to also zoonotic disease and, a targeted kind of call for countries to identify the diseases that are, of most threat to kind of a given country. And so there is a lot of attention towards identifying what those are and then building up the surveillance capacity to be able to collect data about them and then inform decisions on interventions. And I will say one of the challenges is, I mean, you talk about sort of there's the known threats, and then there's also efforts to try to, build up capacity to be able to also identify unknowns. So novel viruses that develop and enter into either the animal or the human systems.
We've got a lot of questions, so I'll keep us moving. What role might museums play in zoonotic disease outbreak investigations?
So I will say what we do have is, I don't know how familiar folks are with the Smithsonian Outbreak exhibit, but one of the critical things, again, is sort of this aspect of will say the awareness raising and understanding, and a lot of that, and also the participation and having folks be able to kind of go into an environment to learn, and museums play a critical role in that aspect. And so we've seen some of the work also with the Smithsonian exhibit, where they've also brought, partnered with other countries to be able to bring some of their outbreak exhibit to other countries. In terms of during an actual outbreak, I'm also curious if anybody, has experience or thoughts on sort of the role of museums during that time. Though this is totally, but one of the things that I've seen some of the museums doing is also sort of, trying to continue their role as environments for sort of lecture series in some of these ways, to be able to also inform individuals on sort of the state of the science or those areas.
Hi, Jessica, this is Tanya Nichols. One of the roles that I see that museums can play is places like Smithsonian that has the collections. They can go back and do the DNA and actually, do more epidemiology than we ever could before. So that would be one way I think that museums could play a role.
That's a great point. Thank you.
Thanks, Tanya. Okay, historically, public health is focused on diseases once a human is infected. How can the testing in non-human species be funded when all of the resources to the public health component, when all the resources to the human health component of public health are? I'm kind of.
Yeah, no, and this is, I mean, I think this isn't only in sort of the infectious disease space, but one of the challenges is always sort of maintaining the investments sort of on the front end, before the emergency happens. And so there is, and I think that there's going to be, renewed interest in sort of this aspect of the increasing sort of some of the viral discovery elements, but that also needs to be balanced with, just because you're discovering viruses, if there also isn't the ability to then sort of do the follow on in terms of, what actions are going to be taken, it ends up being, you need sort of the discovery and this data, the investment into the risk mitigation and a lot of those before you get, if you're trying to address that sort of prevention stage and the preparedness stage. So we'll see. I mean, this is again one of those, we have a lot of new communities involved. I think you've seen a lot of the, the folks that have been in the sort of the outbreak preparedness and response space, you have argued for a lot of the sort of the more sustainable investments and a lot of these issues. But I think there's a potentially much greater understanding of why that's important now, and we'll see what type of investment opportunities end up coming, because there is also the potential. It's just not necessarily government funding, but when you start to look at, the potential for private sector or for finance sectors, or, that there are a lot more communities that need to get sort of brought in to address those sort of front end questions, to be able to really make it robust and sustainable.
Thanks, Jessica. I have one question more pertinent to current events. Thanks for the presentation. Appreciate a reference to California wildfires and comorbidity. There's currently a wildfire raging in Irvine, and my campus is closed and neighborhoods near me are being evacuated. I understand the impact of fires on human respiration. But in the One Health context, there seems to be a paucity of research on the impact of wildfires on spillover events. Are there disease outbreaks that are associated with fires? I imagine fungal spores, etc. Best wishes, Dell from UC Irvine.
Hey, Dele. I do not actually know. This has been sort of sorry, I'm also a California native, so have been, following the California fires rather closely. And so that's been an aspect, just having these events happen at the same time and really starting to have people look at that. There's a genuine reason to be looking at that question, and a lot more folks looking at it. So I don't actually have an answer in terms of whether or not there have been kind of fire-related outbreaks in the past.
Okay, I have one that says, I wonder if you could tell us how the National Health Security Strategy 2019 to 2022 of DHHS and ASPR is involved in One Health.
So this was the National Health Security Strategy? Which strategy?
Yes. For 2019 through 2022.
So I have to say, I can tell you about the National Biodefense Strategy and the Global Health Security Strategy because my focus has been much more international than the domestic. I can speak to, so the National Biodefense Strategy definitely adopted a One Health approach, and it was unique in adding infectious disease threats to the level of bio threats that had traditionally been, the domain of intentional and accidental release. So, one of the big things was it recognized natural outbreaks at the same level, and also was very insistent on the human, animal, plant, and environment health. And within that, it also included, antimicrobial resistance as one of the, priority sort of areas, kind of the threat spaces that needed to be addressed as part of an integrated U.S. biodefense enterprise. And I will say, the United States just released its second national action plan on antimicrobial, on combating antibiotic-resistant bacteria, which is one of the main sort of avenues that we have. It supports our national strategy on combating antibiotic-resistant bacteria. And so the biodefense strategy sort of recognizes antimicrobial resistance as, again, one of these critical components of addressing antimicrobial resistance as a critical component of an integrated biodefense enterprise, and also recognizes sort of this, our what's called our CARB, the combating antibiotic resistant bacteria strategy, executive order, and the new national action plan as sort of one of the main ways in which we implement a major component of that.
All right, we're short on time, so I can ask one more. And what I will do is send Dr. Petrillo all your questions that have not been answered. So therefore, she can respond. But I have the last one that says, how do we encourage community participation when the benefits can't be demonstrated or observed in a short-term time frame? Communities often pay attention to issues pertinent to their day-to-day livelihoods and often with conflicting priorities in developing countries.
No, and that's one of the biggest challenges. And so we have, I highlighted at least the two citizen science ones that I highlighted. Really, I mean, a significant part of it was, the thinking was, okay, again, as you said, like, how do you have it so that there's value to the folks that are involved in being involved, so that there's some aspect that comes back. I think it depends on also an aspect of the nature of what any given community might need back in terms of having the involvement feel kind of worth the time. And in order to do that, one of the biggest things is sort of this, you know, the fun term, co-creation. I mean, it has to be, any of these efforts, community efforts, you know, have to be community empowered. Really having this where, you know, if there are efforts that come in that try to help, you know, kind of enhance communities' ownership or engagement or involvement, you know, it's really has to be an effort where it's, you know, the community is the voice, the active voice in sort of what is needed, what is, you know, in the crafting of whatever that you know, community participation effort is.
All right. I know if you're open to it, Jessica, I will send you the rest of the questions to follow up. Thank you everyone for joining us this evening. It's so great to be back. And thank you, Dr. Petrillo, for all your awesome information. I will just flag that we are going to meet again next month on the 18th of November, which is a Wednesday. So I hope that works for some folks. But yeah, awesome presentation. And if we were in person, we would be handing you a flag flown over the Capitol. So I'll have to get your address so we can show you our gift of gratitude. So thank you so much for your time. It was lovely presentation, and I'll share the feedback. Thank you all for joining us today, and would like to end with reminding everyone to please vote.
Thank you all for joining. Really appreciate it.
All right. Thanks, everyone. Have a great evening. Bye.